I think some key things that I want to know is, well, what does this person do? And how is their condition affect them? So it may be that, 2 years ago, they were training, going to the gym, hill walking, having fun with their kids, their partner, going on nice holidays, and that's all stopped. So you want to know that kind of change in activity. And then we want to know, well, does this patient have pelvic pain? So, the people listening will be really used to doing like a body chart with patients in terms of back and neck pain patients. So what we want to know is, well, are you getting, where are you getting that pain? And then we will go into a bit more detail. Well, are you getting any in that kind of perineum? Are you getting any at the front? So you kind of start with not so much the safe areas, but the areas that people are easier to talk about. And we might say, well, are you getting any kind of tailbone or back pain or in around those sit bones? And then we will say, well, what we find is common with this is people might get scrotal pain. Are you getting that? Are you getting any pain that feels like it's inside the back passage of rectum? And we know with patients that pain at the tip of the penis is common. Is that something you're experiencing? So some patients will forward that information freely. Whereas some patients, maybe first appointment, they're a bit anxious, high levels of stress. So we kind of, warm things up with them. But what we also really want to know is, are they getting urinary, bowel, sexual health related symptoms? And I think, and it would be interesting to see what the people listening feel, is that if you say to most men, are you getting urinary symptoms? That probably means to them, well, am I having to get up at night? Well, I'm not having to get up at night. Am I leaking? Well, I'm not leaking. So a lot of those men will say, well, actually, I'm mainly here for the pain. So some patients, if they're not getting very obvious urinary symptoms, we will say to them, okay, well, has there been a change? Are you having to urinate maybe every hour? Are you having a sudden urgency to urinate? Does it take a bit longer to initiate, which is hesitancy? Are you getting any mild kind of droplets after, which is post-void? So sometimes the patient initially might say, well, I'm not getting, urinary stuff is fine. It's the pain I'm here for. But then when you dig a bit deeper, do a bit more detective work, you find actually they're starting to fit into that box of urinary symptoms. And bowel even more so. You say to people, are you getting any bowel symptoms? And they can sometimes process that, well, am I leaking? Well, I'm not leaking. But what we're interested in is, well, are they having to strain? Is it uncomfortable? Do they feel like they can completely do a bowel movement? And then the big one we ask patients about is flare-up post-sexual activity. And so a lot of my day is talking about what happens after ejaculation. And I think we all know what happens after ejaculation. It's a great thing. But so I will say to patients, well, we know that probably about 60-70% of men with pelvic pain get a flare-up post-ejaculation. Is that something you're experiencing? And they'll go, actually, yes, it's much worse for a day or two, or, that perineal rectal pain, it's flared up. So and then we also ask, well, is there a change in erectile function? However, the kind of good news is most men with pelvic pain have good erectile function, except it causes lots of pain.
Right. But pain not necessarily in the penis itself. It could be
their pain. So it could be that it could be that it could be their groin pain, it could be their coccyx, it could be rectal. It's really their pain. So we hear lots about fear avoidance with back pain. So I've got back pain, I'm not going to bend down and pick that box off the ground because my back might explode. So you get fear avoidance, whereas these men get fear avoidance over kind of masturbation, sexual activity with someone else.
Right. Okay.
Because it's really painful. So this isn't kind of, I'm getting mild discomfort. because I've had sex or I've masturbated, that's gone in 5 minutes. This is a build-up of significant pain that lasts maybe several hours, a day or two, to the point where people are thinking, I'm not doing that again for a while because that's bloody painful.